Okay, well, thank you, and welcome to the last health forum of this academic year. It's wonderful to see so many of you here to wish us well as we go into the summer. Today we do our annual forecast and our trends, what we expect to happen in the next year. I would like to welcome you, the audience, and I would also like to welcome the audience that is with us online. We call that our live stream audience. Okay, so welcome to everybody. You can see I'm just slightly technology challenged, but not too much. And so we'll get started right away. I would like to first introduce you to our speakers and our panelists. We have a wonderful setup for you today. Don Crane, Tom Prisolak, and Paul Markovich. Don Crane is the CEO of the California Association of Physician Groups, CAPG. It's the nation's only professional association that exclusively represents capitated and coordinated care organizations and is a leading voice promoting the interests of physicians practicing accountable care across the country. CAPG consists of over 160 multi-specialty medical groups and IPAs that provide care to over 18 million patients in 24 states. CAPG also serves as a key communication conduit between healthcare plans and their physician networks within the delegated model of delivery and provides a collaborative forum for benefit design, product design, and other strategic initiatives. Tom Prisolak is the CEO of Cedars-Sinai Health System. Cedars-Sinai is the largest private hospital in the western United States, having close to $2.8 billion in revenue annually. Tom Prisolak has been associated with Cedars-Sinai in Los Angeles since 1979 and has served as president and CEO since 1994. He has been recognized for the development of strategic and operational initiatives to foster high-quality, safe, and efficient healthcare, as well as being actively involved in healthcare delivery and finance policy development. Mr. Prisolak is a former member of the American Hospital Association Board of Trustees, which he chaired in 2009, and also served as the chair of the Association of Medical Colleges in 2006. We also have Paul Markovich, who is the CEO of Blue Shield of California, which is a 3.3 million member not-for-profit health plan serving the state's commercial, individual, and government markets. Mr. Markovich assumed the position on January 1, 2013. As president and CEO, Mr. Markovich drives Blue Shield's mission to ensure Californians access to high-quality health care at an affordable price. A 16-year Blue Shield veteran, Mr. Markovich previously served as COO, in which capacity he oversaw healthcare services, network management, e-business marketing, product development, consumer operations, and Blue Shield's 3 business units offering medical and specialty benefits coverage. So I think this is a great, we have here with us tonight sort of the three-legged stool, you know, physicians, hospitals, and payers. And it will be interesting to see whether or not, and if they do come up with the same trends and their different takes on what those trends will be and how they will affect both their own fields as well as patients and consumers and our healthcare delivery area as well. So what I would like to do very briefly is I'm going to just take a couple of minutes to give my take on the trends. I have a couple that came. This is a confession. I cribbed these from my annual lecture that I give as the first lecture I give in my Managing Health Delivery Organizations class. So I borrowed that. So we'll see if my trends also are in alignment with the trends of the experts here. Okay, so these are not in any order other than how they came out of my brain, not in any order of importance or anything like that, just a few different things that seem to come up. One is that we're having increasing, hopefully, the hope is that we will have a decrease in the silos between physicians and hospitals, as well as the external environment, and this will lead to increasing coordination. Obviously, the aging of the population is going to affect the demographics and the way we provide care, and that has all kinds of implication for home care, chronic management, chronic disease management, et cetera. There's a variety of workforce issues as well, with shortages of physicians, changing in licensing for physician extenders. The millennials are having their impact on the way we provide care, being much more technology savvy and demanding more of that in the way that we as organizations respond to their needs. Increasing organizational and clinical alignment in order to meet the population health needs that we have. A variety of new management competencies, all of which we will need to develop teamwork and collaboration for previously siloed individuals to be able to work together, do-it-yourself healthcare, and on-the-job health, where we have organizations and employers giving out Fitbits, having on-site clinics, doing a variety of different techniques like that to incentivize their workforce to be more healthy. Information systems, of course, I think everybody knows about that, but those are increasingly more and more sophisticated. And while we haven't gotten there yet with interoperability, I think we're moving in that direction. Certainly, organizations and provider organizations that share the same EHR, i.e. either Cerner or Epic, are moving toward being able to share some of that data, and that's a big move forward. Financials and insurance, the fact that insurance companies and payers are now aligning and partnering in a variety of different ways on the provider side, rather than just being in contractual conflict and negotiation, is a sign that different things are changing. So we have population health and continued consolidation with a variety of different partnerships forming, not just horizontally across medical groups or across hospitals, but vertically as well. Increases in technology, as I said, with the insurance, with narrow networks and access, crowded EDs, all of that is going to be addressed. And finally, transparency, increasing transparency as the consumers demand to know what is going on, both in terms of quality and in terms of price, and this transparency is going to create demand for the competition and for organizations to do that if they want to continue to be competitive.